Pediatric dentistry is very similar to general dentistry in many different ways. Definitely the treatment that's going to be performed is going to be very similar, with the exception of dentures, partials, bridges, veneers. Those definitely will not be done in a pediatric office, but everything else as far as extractions and fillings, pulpotomies, pulpectomies, stainless steel crowns, cleanings, x-rays, impressions, those are all going to be done within a pediatric office. With a pediatric office, there's nothing that says that a child has to visit a pediatric dentist. Oftentimes, if a parent has established a relationship with a general dentist, then oftentimes they'll just choose to take the whole family to that dentist, and that's perfectly okay. In the practices that I've worked in, we've seen patients from 1 year old on up to 95 years old, and that was not a big deal. We didn't see a lot of child patients in our practice. Patients that we did see, it was kind of a nice little break. It was, definitely those types of patients that were cooperative, that were willing to get done what they needed to do. And there were definitely exceptions when we would have to refer to a pediatric dentistry, and it all depended on the behavior of the child and whether or not they were going to allow us to do anything or not. We never forced the child. If we would try a couple times, if the child was just not having it, we would not force it, and we would just automatically refer to a pediatric dentist. They are better equipped to handle different types of children just because of the types of patients that they're going to be seeing. So a pediatric dentist is going to see, children from birth on up to adolescent to young adult. They're going to see those patients that have special needs, that might have some sort of a mental disability. So even if, a patient is 20s, 30s, but they have some sort of a special needs or mental disability, then more than likely they're still going to see those types of patients as well. There's just a little bit, if you've never been to a pediatric office, it's definitely a different environment. It's a more friendly, upbeat, energetic, cheerful type of a place. I had the pleasure of touring Dr. Greg Evans' pediatric practice here in Fort Collins, and I was blown away. He has, the way he designed his office is that he has a separate area for the parents to wait for the kids. So once the parent checks them in, they go sit in a separate area. They immediately take the kids into this other area that, it's set up to just be very child friendly. It has an arcade, it has a climbing gym in it, it has an area for painting and coloring. They have a TV in there so they can watch cartoons. They have lots of toys in there. So there's a lot of different things that kind of appeals to patients of all levels, from very young to teenagers. So they definitely have a lot of activities and things for them to do prior to them going into the treatment room. Once we went into the treatment room, it was designed very similar to this, which is what most pediatric offices look like, as well as orthodontic offices. Majority of them are designed to be open bay, where that just means that there's a series of chairs that are kind of along the row, and it's purposely designed that way, and it's meant to be a motivator. So for a child who might be a little bit more apprehensive or scared or nervous, they can look over and see the child next to them, that they're laughing, they're smiling, they're talking with the dental assistant, and then it kind of makes them feel a little bit better and helps them to relax a little bit more, to kind of see that going on. And to them, it's like, okay, well, I have nothing to worry about. This isn't really going to be that bad. So it kind of gives them a sense of comfort to be able to be around other kids while they're also getting work done as well. They do have separate rooms that are meant to be for those patients that maybe are having a little bit more extensive work being done, or are maybe a little bit more uncooperative, who might have some sort of a special need or a mental disability that may prevent them from being out with the rest of the kids. So that's just kind of a more private space to put those types of patients where it's not going to be a distraction to the kiddos that are out here in the Open Bay area. So if you've never been to a pediatric office, if you have a chance to tour one, I would highly recommend it. Some of you, if you've either, maybe you've been to one yourself, maybe as you were growing up, you've gone to a pediatric dentist, you kind of know what that environment was like. It was very positive. It was very inviting. It made you somewhat feel at ease just because of the way it was decorated and designed. Or if you've had the privilege of maybe going with a sibling or a family member to a pediatric dentist, it's definitely a whole different type of atmosphere and environment that you're walking into. From a dental assisting perspective, I've always said it takes a very special person to be a pediatric dental assistant, just because the types of patients that you're going to be working with, you're always having to be at a very high level, very energetic, very positive, very motivating. You have to be able to communicate with that patient on their level. With pediatric dentistry, it's a lot of tell, show, do. So you're going to tell them what you're going to do, you're going to show them what you're going to do, and you're going to then do it. There's a lot of different terminology that is going to be very different working in a pediatric office. We're not referring to the saliva ejector as the saliva ejector or suction. It's going to be Mr. Thirsty. We refer to the hand pieces as Mr. Bumpy. Is for the low speed hand piece. So there's and then for the air water syringe, it's with me, what I always did with my pediatric patients is I would kind of squirt water on them to show that it did water, and then it also did air, so I'd also blow air on them so they'd know what it felt like. So again, it's a lot of just entertaining. So again, having to be at that very high level at all times. So if this is maybe something you have an interest in, then I would highly recommend maybe trying to get into an office to shadow. That way you kind of get a sense for what that environment is going to be like.